All right, so let's dive into something I think we can all relate to, sinusitis.
Oh, yeah.
You know that feeling when your sinus is just, ugh,
Yeah.
it's just awful. We've got a ton of research here, articles, insights into remedies.
Mm-hmm.
We really want to figure out, like, what is sinusitis, what causes it, and then, most importantly, how do we deal with it?
Yeah, how to make it go away.
Exactly. Whether that's, traditional medicine, natural stuff, we're covering it all.
And I think, honestly, a lot of people think sinusitis is just a stuffy nose, but it's more than that.
Right.
It's inflammation. Like those actual cavities in your skull are swelling up.
That's crazy. And we actually have a diagram here, which is amazing. You can see all the different sinuses. I had no idea. Like frontal sinuses up in the forehead.
Right.
Then you've got the maxillary sinuses,
Yeah.
kind of near your cheekbones, the ethmoid ones by the nose.
Mm-hmm.
And then deep inside, these sphenoid sinuses. So if you're feeling pain,
Yeah.
you can almost pinpoint which one's acting up.
Exactly. Location matters, but to really treat it, you got to know why they're inflamed. That's the key. Could be an allergen, pollen, dust mites, those sorts of things.
Oh, right.
Could be a virus or bacteria making a home in there. Even fungus sometimes, but that's less common.
So it's like a detective game.
Yeah.
You got to find the culprit. But before we get to treating it, what does it actually feel like? How do we even know it's sinusitis?
Well, it's your body reacting to that inflammation. So, yeah, you get the congestion, maybe a runny nose.
Awesome.
You might get a fever because your immune system's fighting back. Fatigue is common. And sometimes even clogged ears.
Ugh, the clogged ears are the worst. I thought that was just a cold thing.
Nope, it's connected. It's all about this eustachian tube. It links your middle ear to the back of your throat.
Oh,
So when your sinuses swell up, bam, blocked tube, plugged up ears.
so it's all connected. Okay, well, now we know what it is, what it feels like.
Yeah.
Time to talk about getting rid of it. We've got info on both traditional medicines and more natural remedies. Let's start basic, over-the-counter stuff. What do people usually reach for?
Well, for the pain, your typical Tylenol, ibuprofen, that sort of thing.
Right, makes sense.
Then you've got decongestants like pseudoephedrine. They basically shrink the swollen blood vessels in your nose to open things up.
Oh, okay.
And guaifenesin can help too. It thins the mucus out.
So it's all about tackling those symptoms head on.
Mm-hmm.
But then there's also steroid nasal sprays like fluticasone, mometasone. How do those work? Are they different from just taking a decongestant?
Great question. Decongestants give you that quick relief by squeezing those blood vessels, but the steroid sprays, they're going after the inflammation itself, more of a long-term solution.
So getting to the root of the problem, not just masking it.
Exactly.
And we've also got ipratropium nasal spray on here. What's that one do?
That one's all about drying up that runny nose. It's not a decongestant or a steroid, just focuses on those secretions.
Interesting. So many options. But I know sometimes that's not enough. Like, when do you need antibiotics? Is that a sinusitis thing?
Yeah, but usually only if your doctor thinks it's a bacterial infection. Like if your symptoms are really bad or they just drag on past the usual 10 days, then antibiotics might be the answer.
So not just for any sniffle. Got to make sure it's actually bacteria causing the trouble.
Right. Now, I'm excited to talk about the natural stuff. There's so many cool ways to help your body heal.
I know, right? I love that approach.
No way.
What are some of the top natural remedies?
Well, one that seems basic but works wonders is a saline nasal rinse. Just flushing out all that gunk.
I used to think those were kind of weird, but I tried one during a really bad sinus episode, and it was amazing.
Really?
Yeah, and we have research here. It actually worked better than a nasal spray in one study. Pretty impressive for something so simple.
Simple can be best sometimes.
All right, let's get to some of the more unusual remedies. Bromelain, that comes from pineapple stems, right?
It does.
I love pineapple, but
Yeah.
how'd
Yeah.
that help with sinuses?
Yeah. So bromelain is an enzyme, and it's got these anti-inflammatory properties. There was even a study in Germany. They used it to treat kids with sinusitis, and it worked really well.
Wow, that's fascinating. Okay, next one. Bucca. Never even heard of it.
Gucca comes from this plant, Pelargonium cytoides. It's been used traditionally for ages, and now research is showing it's got great antibacterial properties.
Really?
Studies show it can help treat sinusitis by basically stopping bacteria from sticking to your respiratory tract.
So it's like a shield against those bad guys. Pretty cool. Okay, this one's my favorite. Humming. Like actually humming.
I know, it sounds funny. But humming makes your sinuses produce more nitric oxide.
Wait, what? Humming does that?
It does. And nitric oxide has antimicrobial and anti-inflammatory effects.
Okay, I'm officially intrigued.
There's research that says humming an hour a day helped people with chronic sinusitis a lot. It's not an instant fix, but it's pretty cool how something so simple can have such an effect.
I'm adding humming to my routine for sure. We've also got acupuncture on here, which can help with congestion, and Andrographis paniculata. It's a plant with anti-inflammatory and antimicrobial properties.
Lots of options.
So many options. And in our source material, there's actually a table that compares traditional medical approaches with these natural remedies side by side. It's really helpful to see them all laid out like that. I'm curious, though, what stands out to you? Have you tried any of these yourself? What worked, what didn't? Let us know in the comments.
Definitely share your experiences.
But before you go, there's one crucial thing about treating sinusitis. You got to know the cause. Like, is it allergies, a virus, bacteria, even fungus? That makes all the difference in what treatment will work. We'll dive into that in part 2 of this deep dive.
Knowing the cause, that's key. It's like, how do you solve a problem if you don't know what's causing it?
Okay, so how do we figure that out? What's step 1?
Well, your doctor's going to ask a lot of questions.
Yeah.
When did the symptoms start? How long have they been going on? How bad are they? They'll want to know about allergies. Have you been around anyone sick? That kind of stuff.
So it's like detective work, gathering clues.
Exactly. And sometimes that's enough to figure it out, but other times you might need more tests.
Okay.
Like they might look in your nose with a special scope, maybe take a swab to check for bacteria, or even do a CT scan to see what's going on in there.
So sometimes it's easy, sometimes it's more complicated. But let's say you've figured out the cause. You're getting treatment. How do you know if it's working?
Good question. Usually you should start feeling better within a few days, maybe a week, depending on how bad it was and what treatment you're doing.
Okay.
But if it's getting worse, or if you're not seeing any improvement after a week, definitely call your doctor again.
Yeah, makes sense. Because maybe it's not even sinusitis, or maybe you need a different approach.
Exactly. Better to be safe.
All right. So we've talked about figuring out the cause, knowing if treatment's working.
Yeah.
What about preventing sinusitis in the first place? Can we do that?
Oh, absolutely. Prevention is huge. And it starts with the basics, like washing your hands a lot, especially during cold and flu season. That'll cut down on those viruses and bacteria trying to get into your sinuses.
Good old hand washing. Never underestimate it.
And if you have allergies, manage them. If you're allergic to pollen, dust mites, pet dander, try to avoid them as much as you can.
Right.
If you can't avoid them, talk to your doctor about allergy meds. Those can really help.
So know your triggers, have a plan, avoidance if possible, meds if needed. Got it. What else?
This one's a no-brainer, but don't smoke.
Oh, right, of course.
Smoking is terrible for your sinuses, makes you way more likely to get infections.
Yeah, smoking's bad for so many reasons. Okay, hygiene, allergies, no smoking, anything else?
Stay hydrated. Drinking lots of fluids, especially water, helps thin out that mucus and keeps things moving in your sinuses. And if you do get a cold or the flu, a humidifier can help too. Adds moisture to the air.
Oh, yeah. I love my humidifier in the winter. My sinuses are definitely happier when I use it.
It makes a difference. And, there's even some research saying that using a saline rinse regularly, even when you don't have sinusitis, can actually help prevent infections.
Really? So it's not just for treatment. It can actually help keep things clear beforehand.
Exactly. Okay, this one might surprise you, but stress can actually make you more likely to get sinusitis.
Wait, really?
Yeah, chronic stress weakens your immune system, makes you more vulnerable to infections.
So if I manage my stress better, I might be less likely to get sinus issues.
It's definitely possible. The mind-body connection is powerful.
Okay, that's fascinating. So all those stress reduction techniques like meditation, yoga, being in nature, those could actually be helping my sinuses too.
Exactly. It's all about taking care of yourself, mind, and body.
I love that approach. Okay, so we've covered hygiene, allergies, hydration, humidifiers, even stress. It's a lot.
It is. It shows how complex our bodies are, how many things affect our health.
Now, we've talked about over-the-counter stuff, natural remedies. But what about when you need something stronger, like antibiotics? We touched on those earlier, but I think it's worth diving a bit deeper.
Absolutely. Antibiotics are great for fighting bacterial infections, but they're not always the answer, and we got to use them carefully. Remember, they only work on bacteria, not viruses or other causes of sinusitis.
Right, so if it's a virus causing your sinusitis, antibiotics won't help at all. And they can even make things worse, right? Like contributing to antibiotic resistance.
Exactly. That's why it's so important to know what's causing your sinusitis before you start any treatment, especially antibiotics.
Okay, so let's say your doctor has figured out it's a bacterial infection and they prescribe antibiotics. What happens then?
Well, there are a few different types of antibiotics they might use for sinusitis. Some are broad spectrum, meaning they target a wide range of bacteria.
Mm.
Others are narrow spectrum, they're more specific.
So how do they decide which one to use?
It depends. What bacteria is causing the problem? Your medical history, any allergies, how bad the infection is.
Okay.
Sometimes they'll start broad spectrum if they're not sure exactly what bacteria it is, but if they can identify it, they might use a narrow spectrum one to minimize side effects and that antibiotic resistance problem we talked about.
So it's like choosing the right tool for the job.
Exactly. Now, how do antibiotics actually work? Well, some of them stop bacteria from building their cell walls, basically making them fall apart.
Oh, wow.
Others block the bacteria from making proteins, which they need to survive.
So they're basically messing with the bacteria's ability to function and grow.
Exactly. And the way an antibiotic works can affect how well it fights different types of bacteria.
Makes sense. That's why it's so important to follow your doctor's instructions and take the whole course of antibiotics, even if you start feeling better before you finish them all.
Absolutely. If you stop early, it gives those bacteria a chance to come back even stronger and maybe even resistant to the antibiotic.
Like they're learning how to fight back.
Exactly.
Okay, we've covered a lot. Preventing sinusitis, figuring out the cause, understanding antibiotics. But there's one more thing I want to talk about. What about when those treatments don't work? Or if there's something physically wrong with your sinuses that's causing the problems?
You're talking about surgery.
Yeah. Is that actually a thing for sinusitis?
It is. Most of the time, you can manage sinusitis with meds or natural stuff, but sometimes surgery's the answer.
I think a lot of people wouldn't even think of that. So when would they consider surgery?
Usually when nothing else has worked, or if there's something structurally wrong in your sinuses that's causing chronic problems.
Okay, like what? What kind of structural problems?
Well, sometimes the openings to the sinuses get narrow or blocked. That stops things from draining properly and makes infections more likely. Or you could have growths like polyps blocking things up. Surgery can help open those passageways up and improve airflow.
So it's like clearing out the plumbing.
Exactly. And don't worry, the most common type of sinus surgery is actually pretty minimally invasive. It's called functional endoscopic sinus surgery, or SES.
SES, what's that like?
They use an endoscope, basically a thin tube with a camera on it. They go in through your nose and use tiny instruments to remove blockages or reshape the sinuses.
Wow, high tech. What's recovery like after that?
It depends, but most people go home the same day. You'll be uncomfortable for a few days, probably congested. You'll need saline rinses and maybe some nasal sprays to help things heal.
Okay.
But most people do really well and their symptoms get a lot better.
That's good to hear. So surgery is an option, but it's usually for those more complicated cases where nothing else has worked.
Right. Not the first choice, but it can be really helpful for some people.
Well, we've covered so much ground here. From what sinusitis is to how it happens, to all the different treatments, even surgery. But we're not quite done yet. We've got a few more interesting things to talk about. Stay tuned for the final part of our sinusitis deep dive. Welcome back. So before we wrap up this sinusitis deep dive, I wanted to go back to something we talked about earlier, something I'm still kind of curious about, nitric oxide.
Oh, yeah.
You said humming can make your sinuses produce more of it, and that's good for sinusitis.
Right.
But how does that work exactly?
It is pretty fascinating. Nitric oxide does a lot of things in the body. One of them is it's like a signal in your immune system.
Okay.
So it's got these antimicrobial effects, anti-inflammatory. It can even help open up blood vessels, improve blood flow.
Makes sense.
Right.
Where does the humming come in?
When you hum, those vibrations, they actually tell the cells in your sinuses to make more nitric oxide.
Really?
Yep. And then all that extra nitric oxide gets to work. It fights inflammation, it fights bacteria, even helps open up those blocked airways.
So it's like humming is sending in reinforcements, like a special ops team of nitric oxide.
I like that analogy. It's amazing, right? Simple things can have a big impact.
I'm definitely going to be humming more often now. All right, we've talked a lot about treating sinusitis, but what about preventing it? Any tips for keeping those sinuses healthy in the long run?
Well, a lot of the stuff we talked about already, managing allergies, staying hydrated, not smoking, those are all great for prevention. But there are a few other things too. Like, did you know the air quality in your home can actually affect your sinuses?
Oh, really?
Yeah. Dust mites, mold, allergens. They can all irritate your sinuses and make infections more likely.
Makes sense.
So keep your house clean, vacuum, dust, change those air filters. It makes a difference.
It's like you're creating a healthy environment for your sinuses.
Exactly. And what you eat matters too. A good diet, lots of fruits and veggies, whole grains, that helps your immune system and reduces inflammation everywhere, including your sinuses.
So it's not just what we put in our noses, it's what we put in our bodies.
Right. And I got to say it again, managing stress is huge. We talked about how stress weakens your immune system. So finding ways to de-stress, whether it's exercise, meditation, whatever works for you, that's good for your whole body, including those sinuses.
It's all connected.
It really is.
Well, I think we've officially covered everything sinusitis. We've gone from, ugh, my head hurts, to knowing exactly what's going on in there, talking about all the different treatments, even surgery, and we learned about the power of humming. I feel like a sinusitis pro now.
Me too.
And I hope our listeners do too. Remember, knowledge is power. Understanding how your body works, knowing what you can do to help it, that's how you take control of your health. So if you're dealing with sinusitis, don't give up. There's a lot you can do to feel better and prevent those sinus problems from coming back.
And if you're ever unsure, talk to your doctor.
Great advice. Well, thanks for joining us for this sinusitis deep dive. We hope you learned something new and that you feel ready to take charge of your sinus health. Until next time, keep humming.